live. I'm Attorney Amihan April Alcazar for our weekly virtual broadcast, and I'm being joined by our guest from the University of Michigan Medical School, Mr. Zachary Eisner. So please, can you give some greetings to our viewers and listeners for today?
Yeah, of course. Hi, everybody. It's wonderful to be here today. Thank you so much for having me on the program. Really excited to talk about my path with biomedical engineering and now as a medical student, and talking a little bit about services that we've done for emergency medical care.
Okay, great, Zach. So maybe we could begin with you describing for us your interest as a young person and how and when did you actually decide in your field of study first in biomedical engineering and eventually in the medical sciences?
Yeah, of course. So initially, when I was a young person, I had some personal experiences in the healthcare field that brought me in
Mm-hmm.
to see certain doctors and actually dealing with healthcare issues of my own. And
Mm-hmm.
when I was actually exposed to that and saw the great privilege that I had of being able to access these healthcare systems that were able
Mm-hmm.
to, provide cures to me and treat my illness that weren't necessarily available to everybody in the world. That really
Mm-hmm.
inspired me to enter the medical field and to be a medical practitioner that would one day help make these services available to everybody. I also found as I grew up a little bit that I really had that affinity towards the math and sciences realm of
Mm-hmm.
the healthcare and healthcare applied sciences. And so that drove me eventually in undergraduate to get my bachelor's degree in biomedical engineering. So
Mm-hmm.
there I studied the intersection of medicine with engineering and really
Mm-hmm.
where we can apply mathematical principles to help us solve
Yes.
problems in the medical field. I
Mm-hmm.
also ventured a little bit into public health and how we can
Mm-hmm.
apply biomedical engineering through a public health lens to help improve people's lives around the world. So
Yes.
really looking forward to continuing working with that in medical school and hopefully
Yeah.
one day as a practitioner as well.
Okay. Can you also illustrate through your experiential learning skills and competencies how you came to be in your field of study? Because this is very informative for prospective students and even those who are already practitioners but may want to take a career trajectory, whether it be in emergency medical services, as you've mentioned, or biomedical engineering.
Yeah, of course. So some of my most formative experiences in biomedical engineering specifically
Mm-hmm.
actually came way back the beginning of high school or secondary school. And in that, I was actually fortunate to be exposed to an introduction to engineering class. And when I entered
Mm-hmm.
this class, I knew that I wanted to be in the medical field, but I really had no clue what engineering was, why
Mm-hmm.
engineers would exist, and all of that.
Yes.
And
Mm-hmm.
this class, I was about 14 years old, really taught me one, the need for engineers in society, right? The need to
Okay.
be able to approach a problem analytically and
Yes.
solve the problem from a bunch of different viewpoints in order to
Mm-hmm.
holistically develop a solution. And it also showed me some of the basic skills that are used by
Mm-hmm.
engineers. So, for example, I learned how to solder, use a soldering iron, basic
Yes.
electrical engineering, things like that. And I found that I really enjoyed working in that hands-on environment. A lot of the
Okay.
math and physics that I had done up until that point was very theoretical. It was
Okay.
very looking at a blackboard and writing down equations, whereas this
Okay.
was actually applying those equations to help solve problems. And that was
Okay.
really interesting for me. And from that point on, I started thinking, all right, well, maybe this is a career trajectory that I want to pursue further. And so,
Mhm.
one thing that I would definitely say was really important for me was that early exposure to the
Yes.
field of engineering and how that can interface with the healthcare field.
Hmm. And how did that eventually lead you to the decision that if you still had an interest in medical sciences, to reconcile that with your engineering background and your engineering interest?
Yeah, so personally, I view the fields of medicine and engineering as really converging in the future. I do think
Mm-hmm.
with advancements in technology, especially the surgical and surgical related fields, are really going to transition to be more and more biomedical engineering focused.
Mm-hmm.
As our
Okay.
health sciences develop further in the future, we're going to be seeing interfaces of humans and technology that we haven't really seen before. In addition, we can also use engineering principles principles to solve problems of things in the global health sphere. And so, for
Mm-hmm.
example, if we're looking at the provision of care, we can take a systems engineering approach and say, how can we optimize a certain system using mathematical principles to provide healthcare to the greatest amount of people? And so,
Mm-hmm.
personally, I think that convergence of medicine and engineering is really what draws me to continue studying from this biomedical engineering standpoint when we're looking at medicine.
Okay. So how do you foresee then, based on your own explorations, interest, and of course proficiencies right now, your prospective career trajectory that would meld your medical sciences background as well as the biomedical engineering background for, let's say, the 5, 10 years from now on,
Yeah,
henceforth?
of course. So I would love to keep working on trauma care. A lot of the work
Yes.
that we've done with LFR International, working with partners in sub-Saharan Africa, has been to provide emergency medical and trauma care to those who otherwise would not have access to it. But I think
Mm-hmm.
also I would love to work in the rehabilitation sphere as well. And so trauma
Okay.
care really only is that first step. What happens
Yes.
after trauma is, if people have spinal cord injury, other types of things that require heavy rehabilitation,
Patient.
that's
Yeah.
when engineering really steps in. And so I'd love to be either in the trauma or neurosurgical fields in the future, looking into ways that we can not only help trauma victims
Mm.
immediately after a trauma has occurred and get them the best care that they possibly can, but also years down in the future, and how we can help people who have sustained trauma live
Mm.
fulfilled and productive lives despite the injuries they may have sustained.
Okay. So can you describe, because of your involvement in this initiative in the program in Africa, how you foresee the development of this program and your own particular involvement and commitment to its development for the future?
Of course. So right
Yeah.
now, in the short term, so this is the next 5 years. Really, what we're
Mm.
looking at is providing emergency medical pre-hospital services to people. And
Mm-hmm.
so what that means is before they've actually arrived at the hospital, we're
Yeah.
doing care on point of injury at the point of location, and then
Yes.
focusing on transporting those individuals to the hospital. What I would like to see in a longer term project would be actually improving trauma systems in the hospital setting as well,
Mm.
such
Mm.
that once those patients have been successfully managed in the field and successfully
Mm.
transported, as we're working on now, the surgical capacity of these hospitals and trauma centers are better equipped to
Mm.
help these individuals in the hospital setting, and then post surgery in the rehabilitative setting. So that would be more in public health units and other
Mm.
outreach programs that would help with rehabilitation. So I really do
Mm.
see what we're doing with the University of Michigan and with LFR International as a holistic program where
Mm.
the pre hospital emergency care really is just that first step. And
Yes.
with continued involvement and funding and collaboration with partners around the world, we can make more of a holistic trauma care program.
Mm-hmm, I see. So, after you have been given this award from Princess Michael of Kent, specifically for transportation, and that is, of course, related in many ways to logistics and engineering. How then do
Mhm.
you see your active involvement, even as you are still in medical school currently, towards the development of these initiatives, not only in Africa, but possibly adapting it to other areas in the world?
Yeah, of course. So, what we were awarded the Prince Michael Award for was this LFR model, and that's the
Mm-hmm.
model of bystander intervention
Yes.
with, leveraging pre-existing transportation infrastructure. What I would love to see happen from that is us developing more formal emergency medical systems. So,
Yeah.
taking that LFR model and building professional first responders from that, and I think that's something that really can be done around the world just by working with the proper collaborators. I think the most important thing in these types of projects is community ownership. So what
Mm-hmm.
I would hate to see happen is, our team goes into an area, takes complete control over a project, and then
Mm-hmm.
leaves, and there's no
Yes.
sustainability implemented there, right?
Yeah.
So
Mm-hmm.
as a medical student, what I see my current job in these programs as is to be a facilitator of partnerships, of training,
Mm.
of this research being propagated around the world, so more
Yes.
communities can own these projects themselves and continue
Mm-hmm.
building upon the model. And once
Okay.
that base level is complete, then we can move towards more formalization.
Okay. So, what kind of personal qualities do you believe a prospective student or practitioner should possess or develop in order for them to become much more probably successful in this field, whether it is like as you've mentioned, emergency medical services, or even global medical concerns or programs involvement or participation?
Yeah, the primary thing that I say was hard for me to learn at first, and I think is a very important quality to have, is resilience.
Mm-hmm.
I think that a lot of times people who want to be in the medical field often have gone through elementary school and secondary school doing very well academically and not
Mm-hmm.
necessarily being prepared to fail. And
Mm-hmm.
something that I've learned through doing this international work, doing field work in person, and lots of research is that the only way to actually grow and succeed more is to
Mm-hmm.
experience failure. And that's something that I
Yes.
personally hadn't done before I started doing this work. You know, our first
Mm-hmm.
paper that got rejected from a journal was
Yeah.
devastating. But
Uh-huh.
what we then learned from that is how to
Mm-hmm.
improve, how to write a better manuscript for
Mm-hmm.
people to understand and to build from
Mm-hmm.
that.
Okay.
So I'd say resilience is one big quality. Another one would be adaptability, and I think
Mm-hmm.
that goes hand in hand with resilience, but really being able to pivot, take in the information from your surroundings, and switch it up a little bit. So, for
Mm-hmm.
example, when we were working in Sierra Leone, we had a very robust plan of what we wanted to do before we
Mm-hmm.
hit the ground. And then
Yes,
once we got
but
on the ground, we realized that the plan that we had wasn't necessarily um, accurate. You know, we wanted to train only motorcycle taxi drivers. And our collaborator said, well, hold on. What about
yeah,
bus
true.
drivers? What about the
Yes.
teachers? What about people
Mm-hmm.
that we know as people living here are experiencing the most trauma? Why don't we train them too? And so we had to adapt and change our program
Mm-hmm.
to better serve those individuals in their own community. And so I think adaptability really is important to consider both in the engineering space and in the global health space.
Mm-hmm. So, what can you say, Zach? Having academically been very excellent, okay, acing your medical admissions course, and as you said, learning about the reality that failure is part of the experiential learning process and potentially be much more advantageous and valuable in this kind of developmental work that you have actually embarked on.
Yeah, I think that some of the success that I've had academically has also come from failure. So before doing really well on those medical exams, I certainly did not do well on some exams in undergraduate. And what I was able to do was sit down, look at the results from those poor examinations, and say,
Mm-hmm.
here's where I can improve in the future. And if there were one message that I would want to get out there to future people studying in the medical field or engineers, it would be take the time to learn from your failures, because it's
Mm-hmm.
really easy to push them under the desk and forget about them and say, this happened and I'm going to not focus on it. But if you focus on it with a lens of improving for the future, that's how you get to the point where you then ace your final examinations and really do better when it counts more.
Mm-hmm. So I think for now, Zach, because you're still in medical school, though, and you're continuing in your involvement, in fact, with the social civic project, like in Africa, how then could you please encourage those students and even practitioners to continue being encouraged to be in this space where your concern for social civic and medical concerns will still be a commitment for you, and at the same time continue with like the studies that you're currently undertaking.
Yeah, of course. I think time management is really key there,
Mm-hmm.
and learning to focus on the matters that will best impact your mission and
Mm-hmm.
not necessarily focus on other ones that may be distracting from that.
Mm-hmm.
And that sometimes is hard because you'll have an idea that you'll want to follow that might be a wonderful idea and it might help a lot of people. But if
Mm-hmm.
it's not central to the mission that you're trying to achieve, it might end
Mm-hmm.
up being more of a time suck. And so what I've started doing for that actually is I have a log of ideas. These are
Okay.
ideas that I've had throughout the time working on different research projects. That's a save for later folder. Just
Okay.
because I know that I need to be budgeting my time to be
Mm.
working on the projects that will impact the people I'm trying to serve most. Because I also have to go home at the end of the day and study for medical exams.
Okay.
And so I think that's something really important to consider as well. And also that every baby step that you take is a step forward.
Mm-hmm.
So it's a lot harder to make progress when there's immense pressure, right? When you're putting
Mm.
immense pressure on yourself to succeed now.
Mm-hmm.
I
Mm.
would say taking small steps, one step at a time, eventually you will reach your destination.
Mm-hmm. One interesting aspect of the developmental work that you have mentioned was the role of facilitator, and you certainly fit, as you mentioned. I would like to continue in the role of the facilitator, and the fact that you're really interested to get the information out there in order to raise people's consciousness and awareness. So, how then do you think effective communication skills will play into this, and maybe you can look into the opportunities and possibilities of documenting the whole experience or programs that you have been conducting in Africa.
Yeah, I think that would be a wonderful thing to do, and certainly something that I would love to consider doing, just to help other people who are trying to do projects just like this have a
Mm-hmm.
roadmap or a template. Um,
Mm-hmm.
I think that it's difficult because it's a very individual process, and the
Yes.
biggest thing in my mind is just being willing to listen to those around you, right? Listen to those who have experienced this type of thing before, who have done that facilitator work, to
Mm-hmm.
learn from them and then implement those skills in whatever field you'd like to do. So
Mm-hmm.
personally, I reached out to a lot of mentors in the nonprofit sphere, in the engineering
Yes.
sphere, before embarking on this work, and just asked, how do you act as a facilitator when you are trying to bring new work or new information to different communities? And it's
Mm-hmm.
that partnered with asking people in the communities, how can I best serve you? That
Mm-hmm.
really makes the job of being a facilitator a lot easier.
Mm-hmm. Yeah. And again, another important skill set that you've mentioned was about the fact that you're also involved in the research part of it and the
Yes.
publication of medical journals. So
Mhm.
how then do you think fostering this skill set of research is very vital to the success in the medical field and also in the engineering field and in combination, as well as like in most facilitation and developmental work that you're going to be doing in this sphere of social civic engagements.
Yeah. So one thing we're seeing right now in the world is a massive shift towards evidence-based medicine, and
Yes.
really getting rid of practices that don't have much base in research and replacing them with new practices that we've seen work time and time again in these research studies that have then been published. And I would say that's really important, right? Because what evidence-based medicine does is it allows us to provide better care for the
Mm,
patients and for people that need it, hopefully with better outcomes as well.
mm,
Um, regards to developing research skills for people and why that's important, I think much like being an engineer and thinking analytically about problem solving, developing a strong base in scientific research and scientific methodology will allow people to approach problems more tactfully, will allow you
mm-hmm,
to think of how can I translate this idea that I have into
mm-hmm,
reproducible results that can actually help people. And that just takes practice. I certainly was no master at research when I first started out doing this type
mm-hmm,
of work, and I'm certainly no master at research now. It's something that I'm continuously improving, continuously writing and rewriting and editing manuscripts. And I think
mm-hmm.
that it really is a skill that someone has to develop. Nobody's born an amazing researcher.
Yes.
So again, like many skills, practice makes perfect.
Yes. So you've been recently awarded by the Prince Michael of Kent Foundation, as you've mentioned. And so, how does this impact insofar as your own motivation, initiative, and continued commitment to the program is concerned, and your foreseeable role in evolving and developing this particular program and this organization?
So I think recognition is wonderful. And it really does feel good personally to be recognized for the work that we've
Yes.
been doing and all of that. But far more importantly, I think that winning an award such as the Prince Michael Road Safety Award um, allows us to leverage publicity, right?
Mm-hmm.
Because the most important thing when you're trying to solve some sort of issue that the world doesn't really think about on a daily basis is
Yes.
getting people to think about it, right? We
Yes.
need people to say, oh, wow, I didn't realize how many people are literally dying every day because they don't have access to
Mm-hmm.
emergency trauma care. And so, if we can use things like that award to help people just think about it or even learn about it for the very first time, that's how
Mm-hmm.
we can do things like garner more funding, garner more support, and build out these programs to help more people.
I see. So I think you've got your work cut out for yourself,
Yes,
definitely,
ma'am.
Zach, in so far as medical school is concerned and your continued involvement. So, what message can you give to the young people out there, whatever field of study they may be interested in, and specifically if they were so interested in biomedical engineering as well as in medical sciences, for them to begin exploring and maybe identifying their particular interest with the hope that they will also become practitioners in your particular field of study.
I would say two things. The first is if you have an idea and you think that that idea is really unique and will help people, no matter what obstacles you think might stand in your way,
Mm,
now is the perfect time to start. Because, like I said earlier, baby steps will eventually help you reach your destination. So, if you
mhm,
start now, even if it's just by writing down that idea and maybe jotting down 5 or 10 bullet points about how you might execute a plan to actually implement that idea, that's
yeah.
infinitely better than writing nothing. So, that would be my
Mm,
first thing. And my second thing, and this is more for the engineers out there, is
mhm,
math and science and engineering are hard. It is not
mhm.
an easy field to go into. And I say that
Yes.
as somebody who has graduated with a degree in biomedical engineering. You know, I've been there and done that, if you will.
Yes.
Um,
Uh-huh.
but everybody thinks it's hard. So if you're struggling with a math problem or an
Uh-huh.
equation or a function,
Mm,
that's totally okay. Embrace that struggle, embrace how hard that is, and use it to learn and make yourself better. Because you're not alone in thinking that it's hard. Pretty much everybody does, even if they won't actually admit it to you. But it's
uh-huh.
really the working through that that makes you a great engineer and a great medical practitioner. So that would be my key piece of advice for those looking to go into the biomedical engineering sphere.
Okay. Well, it's been great having you, Zach, in our program, and I hope that you have been an inspiration as well as a motivation to the viewers and specifically to the students who are listening out there to overcome potential constraints, obstacles, and difficulties that they may encounter in the different fields that they are undertaking, and specifically if they were also undertaking in the same fields of study that you have been studying. So again, we really like spending time during this very interesting and innovative discussion with you. The best of luck to all of your studies, and we hope that we will continue communicating in the future.
Yes, ma'am. Thank you so much, Dr. Alcazar. It was really wonderful to be here talking with you today, and I look forward to speaking with you very soon in the future.
Okay, thank you very much, and we'll be right back. Good day to you all. This is AAA Live. This is Attorney Amihan April M. Alcazar. And right now I'll be interviewing our guest for today, Mr. Peter Delaney. He's from the University of Michigan Medical School. And so can you please give some greetings to our viewers today, Mr. Delaney?
Hi, everyone. Thanks so much for joining today.
Okay, I'm
Really
really happy
excited to
that
be here with you.
Okay, I'm really happy that you could give us some of your valuable time. And I'm thinking that our discussion will not really be only focused on your different fields of studies, but specifically on an award that you were given. And this is with respect to some medical projects that you were able to initiate in the continent of Africa. So I'm really looking forward to our discussion for today. So I guess we have to begin from the very beginning, Peter, insofar as when and how did you actually decide on your field of study? Did this relate to your interest as a young person?
Yeah, so I think when I was young, I had really three primary interests.
Mm-hmm.
The first of which was healthcare. It was really what I grew up knowing. Both of my parents were involved in healthcare. My mother was a nurse, and my father was a physician. And so I kind of grew up discussing that at dinner time, and it was really all I ever knew. Saying that, I wasn't pushed into it, but it was definitely something that I had an early interest in. And beyond that, I also had an interest in thinking about and discovering new things. And so I knew that really took the form of oftentimes research. And I thought that that was something I definitely wanted to have as a component of my future career. And then thirdly, I think meeting new people and languages were something I was also really interested in growing up. So I was really fortunate to go to a school that offered a number of different languages. So I learned to speak Spanish and French and Portuguese as I grew up at an English-speaking school. And so, later on had an opportunity to employ a lot of those through the work I've since done and been engaged with. So I think growing up, I knew that, or at least I hoped there might have been a career or field that would allow me to really combine all of those interests in one. And so I went off during high school, got involved in some science research through a program
Mm-hmm.
in my high school, and ended up getting a scholarship to university to study biology and chemistry. And when I got there, part of the sort of distribution requirements that they had us do was really explore other fields, and they forced us to take classes in other departments. And so I signed up, I remember, for this course called Intro to Global Health, which was in the
Yes.
Department of Anthropology.
Yes.
And I had never heard of the word anthropology, and later on discovered that through this course really realized that it was had an opportunity to combine a lot of my different interests in one, and from there really did a whole pivot 180 away from sort of the hard sciences, and began to realize that I would still be able to look into healthcare, as well as conduct research and meet new people and use languages in this field that was more focused on kind of, as I like to think about it, sort of the macroscopic instead of the microscopic.
Yes. Mm-hmm.
And so, through those experiences was then able to realize that this might be a career I'd like to pursue in the future.
Yeah, so let's go and walk through the different experiential learning skills and competencies that you were actually speaking about, because I think
Sure.
that is of most interest to our prospective students as well as those who have already chosen a career trajectory but still exploring insofar as other opportunities are concerned. So you mentioned about the proficiencies in the hard sciences, because you mentioned about winning a scholarship for biology and chemistry. And then secondly, of course, your interest in learning different foreign languages other than English. And then,
Yeah.
of course, you mentioned about the opportunity to meet people not only in your home country but also from other countries. So how can you describe for us, did the field of study that you undertook in the undergrad prepare you eventually for that career trajectory that you have taken so far?
Yeah, I think it was absolutely essential. It provided me with a foundation of research skills that I was then able to employ in the work I eventually did, as well as gave me an opportunity to, in a space that felt very secure and structured, be able to get early exposure to a field where I'm now able to operate ostensibly fairly independently. And so I still remember that first experience was traveling with one of my professors to Uganda in 2016. And that was initially to conduct what's known as an ethnography, which is where you really drill down really deep to understand a society or a group's understandings. And in doing so, learned a lot about local notions of trauma in rural eastern Uganda. And that was really where my eyes were open to the sort of lack of robust emergency medical services that were absent in many parts of sub-Saharan Africa. And so that experience not only allowed me to begin to hone some of those skills, but also introduced me and sort of inspired an interest in treating a lot of the injury that I was able to witness and realize that this was a problem. Alongside some of my studies in college, I ended up getting a sort of degree as a emergency medical technician, as well as a Red Cross first aid instructor. And so I think as I was going through that, serendipitously realized that there would be an opportunity to apply all of those skills in that single experience. And then from there, things just snowballed. And I think, having those skills up front, though, and understanding, how to begin to look at culture, it would inform the needs assessments we'd then do, and understanding the impact that culture and social determinants of health beyond just acute health issues people might suffer was extremely formative and important toward, later on informing the career I ended up taking.
So what kind of career trajectory do you project for yourself henceforth? And I guess we're speaking about like the 5-year or the 10-year projection here in terms of like the schedule, because now that you're involved in this nonprofit initiative and actually a inter-country initiative, how then do you foresee your career trajectory unfolding, both as a medical practitioner and also, as you said, a global health practitioner in particular?
Yeah, it's a great question. So I think primarily, I see it following a lot of where the research takes us in some ways. So oftentimes, part of research is discovery of the problem in the first place, and understanding how to ask the sort of insightful question is oftentimes half the battle, because you can be presented with a really broken system and not even know where to begin. And I think right now we're in a position where we've identified a really important problem that we've begun to tackle. And in doing so, it's opened up, a sea of new opportunities. And so now, as continuing the global health work, as well as getting a medical degree here at Michigan and working as a researcher at the Michigan Center for Global Surgery, I see a sort of evolution in our work transitioning from the pre-hospital setting, evolving into sort of the clinical setting, and saying, what we've begun to address is how to more cost-effectively and efficiently provide emergency care in resource-limited settings.
Yes.
And I think the really nice corollary to that, as sort of my expertise evolves as a physician, and I have those continued opportunities to engage in that work, will be a transitioning that focus into, well, as soon as you set up an ambulatory system, there will be more critically injured patients arriving at the hospital. And so you need the facilities and the personnel and the infrastructure to be able to deal with that increased burden of patients arriving. And so I really see that interest sort of following the problem and evolving into how I'm able to then efficiently scale up both surgical and emergency capacity from a trauma-based perspective, but in the clinical setting at the hospital. So I think that's likely where I see the work going as we continue to work on the pre-hospital setting now.
Okay. So can you discuss with us then this particular project that you had initiated in Africa, the
Absolutely.
organizations that you have been involved in, and specifically also the award that you have been given for this work that you have undertaken in the past 5 years?
Yeah, I'd be happy to. So I, looking back, so in 2016 when I first went, I remember there was one really illuminating moment I had,
Mhm.
and I was with a research assistant walking through one of the markets, and transportation in sub-Saharan Africa is predominantly provided in short and intermediate distances by motorcycle taxis.
Yes.
Um, which I think are not dissimilar from some of the tricycles we had discussed earlier
Yes.
in the
The
Philippines.
Philippines. Yes.
Right. And so I remember seeing an individual who, in a busy marketplace was struck by one of these motorcycles
Yes.
and went unconscious. And my immediate reaction was to say, okay, well, where are the sirens? When's the ambulance coming?
There,
And
there's no
eventually
ambulance.
asked,
There's no ambulance coming.
exactly. And that was coming from a setting of, the United States. It
Yes.
was really just a moment that was shocking and for me extremely illuminating to say, oh my gosh, this is what something I take for granted and
Yes.
assume is should be here is not. And so we began this project training some of these individuals and taking that sort of background in anthropology, trying to really better understand all of the factors that both contributed to the reasons why motorcycle taxis would drive quickly and recklessly
Yes.
and were
Hmm.
disproportionately involved in accidents, as well as
Yes.
the role law enforcement played, and then the role health played. And so we ended up creating a model where instead of penalizing and going after these motorcycle taxis were causing the accidents, we decided to instead train
Mm.
motorcycle taxis who would voluntarily then provide emergency care to victims of traumatic injury.
Mm.
And it was fascinating to sort of then track the changes that occurred over 3 and 5 years. In that, we started our first project. We just trained 154 motorcycle taxis in a small town of about 100,000 people in rural eastern Uganda to provide care. And 3 years later, we tracked it for 3 years, both in patient impact and knowledge outcomes, and then sort of involvement. And we expected that, well, it's a voluntary program. This is a pilot study. We don't necessarily
Yes.
expect this to continue. What we
Mm.
found was that 75% of those initial participants were still voluntarily providing emergency care after three
Hmm.
years. And that was shocking to us. And it was one of those times when, you can't really predict an outcome of a study like that, but it was a phenomenon
Exactly.
we jumped on. We said, oh, there might be something here. And so we
Exactly.
ended up launching pilot studies in Chad, in a town called Amihan, which is one of the most resource limited settings in the world. It was
Hmm.
just a town of 36,000 people, and then also launched a program with about 4,500 trainees in Sierra Leone in the northern
Hmm.
province there, and then tracked those programs and again knowledge and patient outcomes and involvement. And we found that consistency in the model. And when we really dug down to say, okay, why are these people continuing to provide voluntary care? There were a
Yes.
few reasons that were driving this motivation and participation.
Hmm.
And again, was trying to pull in more of those soft science skills of that anthropological side of
Hmm. Hmm.
understanding motivation and
Yes.
not as much of the hard sciences and measurement, but more of the qualitative work. And in that sense, we really found that when they were trained as these first responders, they
Hmm.
underwent this evolution in their identity where they weren't just seen as transportation providers. They saw themselves as first responders for the first time, and they had an ability to sort of fight this stigma of, we're reckless and dangerous and a necessary evil because there's no other transportation alternatives. And so they ended up continuing to provide care. And then because they had undergone this sort of identity change, customers also saw them differently. And so they ended up basically ending up making between 30 and 40% more in their income than compared to
Hmm.
counterparts who didn't undergo the training. And so they had both this social and this financial incentive to continue providing care, which was, for all intents and purposes, this voluntary program. And so what we had essentially discovered was this sort of self-sustaining mechanism to provide care in these extremely resource-limited settings where, traditional ambulatory systems would not have
Will
been
not be,
feasible.
yes.
And so, as a result of that work, Prince Michael of Kent, who's a member of the British royal family in the UK, runs a foundation that awards or distributes awards annually for kind of innovative projects that improve global road safety. And so we were very fortunate just this past year to have been recognized and received the Prince Michael International Road Safety Award from His Royal Highness, which was a great, we thought, great recognition of all the work that had been done over about 5 years, and was really exciting and motivating to sort of continue that work now and begin projects in alternative settings. And so we're starting work now this year in Kenya and Nigeria. And last year we did some work in a middle-income country setting in Guatemala with the police force there and firefighters. And so we've been looking at different ways we're able to apply the model now. And it's sort of reinvigorated a lot of the work we've been doing, which has been just so exciting. And obviously receiving tremendous support here now at the University of Michigan as well from our partners and research collaborators as well. So it's been a really fun journey.
Okay. So from all of these experiences that you've had, especially in the last 5 years, and even prior to that, when you were actually exploring the different fields of study and the eventual interest that you develop, what kind of personal qualities do you believe should be present for prospective students or practitioners of global mental issues and concerns that they need to develop in order to become potentially successful in this field?
Yeah, I think, again, I think there's probably three primary. Being adaptable is extremely important. When you go into a new setting, or essentially, a setting that is a resource-limited setting, you have to work with what you have at your disposal. And you can't rely upon traditional infrastructure, things one might be used to in alternative settings. And so you really have to be creative in the way that you're using what you have at your disposal. So I'd say adaptability is one of the most important. And I think part and parcel in that is also having, being innovative. So I think those really go hand in hand. But looking at things from a trying to, a creative sense about some of the work you do is always fun. And I think it's something that oftentimes can discover new ways to, in this case at least, affordably provide emergency care in these resource-limited settings. And then finally, I'd probably finish with just being open to new things. I didn't really expect, that all of these projects would snowball into this, fascinating model that we've now implemented. And I initially went to Uganda to really just have an experience to grow my research skills and learn more about the field of global health. But really just being open to that experience opened so many doors than I could have ever imagined. And so I think if you remain adaptable and try and be innovative and are open to new opportunities, you're bound to stumble upon some really, really wonderful experiences where you're then able to use a lot of the skills that you've honed over your time in university and really apply those in a way that I think makes a meaningful difference and a positive impact upon the lives of others.
So what sort of advice can you give, Peter, to those prospective students or even current practitioners who might take an interest into exploring what you have been doing and conducting, and maybe even expand on the kinds of models as well as the area or regions where you have actually been located? So insofar as, one, having the skill sets for the hard sciences, I believe, and then secondly, of what you were talking about, the softer science or skill sets that more bounded by personal qualities.
Yeah, I think sort of what I might have mentioned before in as you begin to attack a problem, so many more doors and opportunities open. I think in this case, I think for anyone interested in the work, now we have this very basic model that we're hoping to essentially develop into a blueprint of how you can evolve really formal emergency medical services from a beginning with a basic model. No one's ever demonstrated that. And currently the World Health Organization says, these sort of lay first responder, training lay people should be the first step toward developing sustainable emergency medical services. But no one's ever demonstrated it, taking it from this small basic model into a very formal professional system. And so I think that opportunity is still out there. And part of that is setting up dispatch infrastructure to be able to better coordinate the responders mobily, as well as understanding which curriculum is the best. So right now there are 3 predominant curriculums out in the field. There's the basic emergency care model that the World Health Organization's published. There's the LFR model, which is the one we've developed. And then there's the EFAR model, which came out of South Africa in around 2012. And so, assessing the efficacy of those curriculums will also be really important. So I think for those people interested, we're always open to collaborations and working with any interested students and parties as well, and open to new ideas and proposals. I think it's tough to say if there's just, one thing that we're interested primarily in pursuing. As I said, so many doors open, and I think anyone with a complementary skill set or with the interest to look at a problem from a new angle or lens with a unique background always has something valuable to contribute. So I think in this case, would always be open to collaboration and with anyone.
Yeah. So we were talking about different collaborations. Can you also describe for us the kind of collaborations that you've already entered into and the kind of partners that you have been working with, at least in the continent of Africa, as illustrations of the work that you have done?
Sure. So attacking, problems like this, obviously, they're very multifaceted, and they're coming from a personnel side and an infrastructural side and a really health systems approach as well. And so having multiple partners was oftentimes very important to us. So I think one of our largest projects we've done, as I described, was in Sierra Leone. Where we trained about 4,500 responders. And what we ended up setting up was a national coalition of 5 partner organizations who worked to, all with the primary aim and mission of scaling up emergency medical services. And so we partnered with a government auxiliary organization. In Sierra Leone, the Red Cross there actually is a government mandate. And so they're seen as an auxiliary with an exclusive sort of ability to conduct these trainings. They were an essential partner, and they chaired the coalition we ended up putting together. And then we involved the University of McKinney, which was the local university in the northern province of Sierra Leone where we were working. Then there was ourselves, and then the Holy Spirit Hospital, which is the largest private hospital in the northern province. And finally, ARCT, which was Agency for Rural Community Transformation. And they were an organization that sort of, I suppose, coordinated all the local logistics alongside. And so we had, a hospital with a healthcare perspective who was receiving the patients that were being treated so they could contribute and sort of give feedback. We had the university, which meant we could study it locally. And then we had, obviously, the Red Cross involved, and they were the ones who were trained to be these trainers and implemented the model in that sense as a sort of auxiliary of the government. And then we obviously provided the curriculum, trained the trainers, and trained initial cohorts of providers. And so I think in that case, as you saw, it was a big coalition of members who each had a very distinct role. In alternative places, for instance, now we're working in Kenya with Masinde Muliro University of Science and Technology, which is one of the universities in Western Kenya. And they're primarily a partner now who we're launching a pilot there. And so that comparatively will be, a project that begins with a smaller scope. And then once, the evidence is there, we would hope to involve like a Ministry of Health type player and partner in that in that partnership to then be able to scale the model, because oftentimes organizations or partners that are nationally facing and have a national scope also have an infrastructure to be able to scale up that work once we demonstrate efficacy with a pilot, as we've now demonstrated in every country we've been to. So I think oftentimes when we're looking to coordinate those partnerships, we start with that small pilot, and once we demonstrate efficacy, look to scale up nationally with a big national partner, whether that takes the form of a Ministry of Health or a government auxiliary, or a more of a social civic organization, or a university with multiple arms and branches around a country. So that's sort of
First,
some examples for you.
yes. So first of all, I think congratulations is in order for you and your organization for the good work that
Thank
you
you.
have been doing. And of course, it's a fascinating model that you have been discussing with us. And we hope that in the future, it will be possible for your organization and yourselves to potentially look at the Asia Pacific region where the Philippines is located as prospective pilot areas where the field of, as we've mentioned, called the global health concerns and allied medical sciences can be further developed through training based on the model that you have conducted, which really involves the training of lay people, something that is very pioneering and innovative in your field of global medical services that we have been discussing. So I think this is a very fascinating and informative discussion that we have. We look forward to eventually maybe collaborating. We Did you actually think about documenting your experiences in the form of like documentaries, or it is in process insofar as your documentation and researches are concerned?
Yeah, no, it's definitely something we're open to. We haven't, obviously, we take lots of photos,
Yes.
and we'll record some of the trainings we provide. But I think that's a really wonderful idea. Not something we had
Mhm.
previously considered. But as you mentioned, we would be so excited to explore
Mhm.
work in the Asia Pacific region, and I think the Philippines would be a wonderful location to begin exploring those initial pilots to see if
Mhm.
that model and the lessons we've taken from the work we've done over the past 5 years would be applicable to that setting and impactful as well in a really cost-effective
Mhm.
and efficient and impactful manner. So really appreciate you making the time to chat with me more, and really appreciate the platform to highlight the work. So thank you so much.
Yes, so it's been great having you, Peter, in our program. So we look forward to future communications with you, and we hope that you will consider, again, as we've mentioned, the possibilities of um, furthering your cause by using different mediums such as documentaries, I think, and more
Yeah,
informative collaborations with different parties in order to propagate, as it were, the very innovative approach that you have done for global medical sciences. So
well,
thank
thank
you
you
so
so much.
much, yes, for your valuable time. And so we look forward to meeting you again very soon.
I look forward to it. Thank you so
Okay.
much, Dr. Alcazar.
Thank you so much. Okay, thank you.